greeting Dr. Shilaya, greeting my Dr. Shetan. So my work, my project work is today I wanna talking about epidemiological profiles of acute diarrheas in children under 5 years of age attended at the emergency department of Hospital Geral Mavalane between 2021 and 2022. This was this topic table of contents. First, diarrheas represent global burnings or particularly affecting children under 5 years. So, World Health Organization estimated that globally we have 25,000 children under 5 years of age dies annually. In Mozambique, in my countries, diarrhea is estimated to account for approximately 20% of deaths. In the rural community of Manis, Southern of Mozambique, indicated that diarrheas contribute to approximately 20% of hospital admissions, ranking as the fourth leading cause of mortality, preceded by malaria, HIV, and pneumonia. Another research conducted in Hospital Geral of Mavalane from 2014 and 2015, analyzing of 161 infected fecal samples unveiled a detection rate of diarrhea causing etiologic agent at 71%. Hence, the objective of this study is to undertake a true investigation into epidemiological profile of acute diarrhea within this particular demographic. Acute diarrhea is distinguished by the abrupt onset of 3 or more loose stool per day, which durations of the 2 weeks. The diagnosis of acute diarrhea typically involved a comprehensive assessment, including medical histories, through clinical examinations and appropriate laboratory tests. Cause of acute diarrhea treated at the Hospital Geral Mavalane Emergency Department depending on the severity of the patient. So, in developing countries, including here Mozambique, acute diarrhea are treated with antibiotics, and most antibiotic registrations are provided empirically without period screening of the agent. So the etiology of diarrhea encompasses both infections and non-infectious origins. Another research conducted an epidemiological study in here Mozambique focused on diarrhea in children under 5 years old. Their research emphasized the need for target interventions to alleviate disease burden. So this research have aimed to evaluate or assessment the epidemiological profile of acute diarrhea among children aged under 5 years who sought medical care at the emergency department of Hospital Geral Mavalane during the period spanning from 2021 to 2022. We have specified objectives to estimate the incidence and the prevalence of acute diarrhea by genders, age groups, and season during this period. To assess the variations in the incidence of acute diarrhea among sex, age groups, and neighborhood during this period. Another objective is to examine the temporal distributions of diarrhea at the Hospital of Geral Mavalane Emergency Department during this period. And finally, to evaluate the effectiveness of preventions or treatment interventions currently in place at the Hospital Geral Mavalane Emergency Department. So, which methodology we use to collecting data? Source of data. The second was secondary data started from medical record. I used the medical record in the lookbooks of children who were attended on this department, emergency department, between January for December, January 2021 and December 2022. So, which the design of study was retrospective studying using secondary data. We use population 10,000 according for district of Maputo. So we use this sampling population at risk was 10,000, and the number of sampling size we used in this study was 385 were diagnosed with this disease. So all children under 59 months are completing the eligible medical record available for reviews such as genders, treatment, and clinical outcome. Exclusion criteria was used in this study to include all incomplete or illegible records, children with diagnosis of other disease or medical condition that may influence the research outcome. What the first results of this report? Firstly, we took to find some geographic distributions of disease, diphtheria in children treated of this hospital. So the epidemiological profiles indicated a high incidence of diarrhea in children originating from Kamavota and the Kamashakeni district. So there is some statistical difference of this about this municipal district. So we show that a higher incidence we show in this place. Second point is about the geographical distributions of acute diarrhea in children. So we saw something here about gender distributions. So here now, before talking about the gender distribution, we talk firstly about the age groups distributions. So we have three lines. These graphs show some trending about the different age groups. First age group is 0 to 1 month or under 1 year, and we have children with 1 year to 2 years, and more we have children above 2 age. So according to this graph, this reading line show us that the children aged 23 months aged proved to be risk factor for this incidence, or we are talking about this age is the proved to be a risk factor for this incidence of acute diarrhea, showing us high incidence in children for these groups compared to another age groups. So we find some reports like 32 cases per 10,000 children a month. Another result we find in this study is about gender. So we took it to look if gender have significant difference, gender, males or female. If we will find some difference in this disease. So according to this report, maybe we find here these two graphs in our left. We saw some variations of data about the family data and the male data. So, despite this disparity in gender distributions among diarrhea cases, statistical analysis using some statistical analysis like main witness test revealed no significant difference. Bullet 3, we're looking also the temporal distributions of acute diarrhea in children treated in this hospital. So, using seasonality, we look at it to see if seasonality has some influence of acute diarrhea in children under 5 years. According to, even we have first figure here in left, we have date and dry, seasonality, and in rain. So, according to this result, although an increase in diarrhea case was observed during certain period. So, certain period when we looking of the average of case during in years. So if we look here, January, or maybe in month May, we have low data of cause of diarrhea than in November. So despite of this result, seasonality had not influenced on the incidence rate among children treated in this hospital. Finally, we look at about the clinical outcomes and effectiveness of preventions or treatment. So here we look at if the treatment or interventions where this hospital used to treat diarrhea in children under 5 years have an effectiveness. So in this hospital, use oral zinc sulfate and antibiotic to treat of this disease. So when we're looking for this graph, we see that discharge we have high number of this discharge than other categories of outcomes. So these interventions and order demonstrated some efficacy in the management of acute diarrhea. And also, statistical analysis show us some difference between clinical outcome. First discussion. First, the percent factor to consider why Kamavota Municipal District exhibit high incidence of diarrhea.